What is heart attack? The root causes, connection between high blood pressure. When blood flow to a section of the heart muscle is suddenly interrupted, it is known as a myocardial infarction, which is the medical name for a heart attack. This frequently happens as a result of a blood clot forming in a coronary artery, which supplies blood to the heart. The obstruction inhibits oxygen and nutrients from getting to the heart muscle, which leads to heart muscle cell death if the blood flow isn't quickly restored. The extent of a heart attack depends on the affected area's size and how quickly it receives medical attention. Crushing, squeezing, or pressure-like are typical adjectives used to express chest pain or discomfort. These heart attack symptoms are typical ones. There may also be effects on the arms, back, shoulders, neck, and jaw. Examples of respiratory difficulty include respiratory conditions or the perception that breathing is difficult. Chest discomfort may also be accompanied by other heart attack symptoms such as cold chills, nausea, or disorientation. It's important to keep in mind that not everyone will experience heart attack symptoms, as they might vary from person to person. Unusual symptoms including tiredness, dyspepsia, or pain in the upper back or neck can occur in certain persons, particularly women. A full recovery is more likely and heart muscle damage can be reduced with early management. Prescription drugs, surgical techniques including coronary artery bypass surgery or angioplasty and stent placement, or medications are all available as treatment alternatives. Lifestyle changes and ongoing medical care are frequently needed to reduce the likelihood of developing future heart difficulties. High blood pressure and heart attacks are related. High blood pressure, often known as hypertension, significantly increases the risk of heart attacks. These two cardiovascular conditions have a lot in common. As an illustration, examine the relationship between hypertension and heart attacks. An increase in vascular stress. High blood pressure exerts too much force on the artery walls as blood is pushed through the circulatory system. The harm that this increased stress might cause to the arterial walls can culminate in atherosclerosis, a condition in which fatty deposits, plaque, accumulate inside the arteries. Atherosclerosis. Atherosclerosis narrows the arteries, which reduces blood flow. Blood clots may form as a result of an atherosclerotic plaque rupture or opening. These clots may block the flow of blood via a coronary artery, which may cause a heart attack. A coronary thrombosis is one illustration of this. High blood pressure increases the heart's workload by making it more difficult for it to pump blood against the increased resistance of the arteries. As a result, the left ventricle of the heart may gradually thicken and grow, a condition known as left ventricular hypertrophy. Since it can harm the heart muscle, this illness can lead to heart failure, another cardiovascular disorder strongly related to heart attacks. Diabetes, obesity, and high cholesterol are just a few of the heart disease risk factors that are frequently connected to high blood pressure. Affected organ damage. The heart, kidneys, blood arteries, and several other internal organs might suffer damage from persistently high blood pressure. This damage raises the overall risk of cardiovascular events, including heart attacks. Controlling high blood pressure necessitates lifestyle changes, such as a heart-healthy diet, frequent exercise, and stress management, and medication, if required, to lower the risk of heart attacks and other cardiovascular problems. The stress on the heart can be reduced, atherosclerosis can be slowed down, and heart attacks can be avoided or reduced with effective blood pressure management. Routine medical visits are crucial for monitoring blood pressure and making the necessary adjustments to treatment plans. What are the remedies and preventative measures? Lowering risk factors and managing the condition are the main goals of heart attack prevention and treatment strategies. The following are important techniques for both prevention and treatment. Eat a diet rich in fruits, vegetables, whole grains, lean proteins, and low-fat dairy products to support heart health. Prevention. Choices for a healthy lifestyle. Reduce your intake of added sugars, saturated fats, and trans fats. Exercise. Make an attempt to exercise your body on a regular basis. Every week, try to do 75 minutes of vigorous exercise or at least 150 minutes of moderate exercise. Keep your weight in check to reduce your risk of developing diabetes, high blood pressure, and high cholesterol. Avoid being around people who smoke and stop smoking. Managing medical conditions. Elevated blood pressure. Monitor your blood pressure and take the necessary medications and lifestyle changes to control it. Lowered cholesterol levels can be achieved through diet, exercise, and, if necessary, medication. Diabetes. Use medication, a nutritious diet, and exercise to manage blood sugar levels. Obesity. Control your weight to relieve some of the strain on your heart. You should keep your alcohol consumption to a minimum and only sometimes. Learn and put into practice stress reduction techniques including yoga, meditation, and deep breathing. If you have certain risk factors or health issues, your doctor may advise medications like blood pressure pills, cholesterol-lowering treatments, or antiplatelet pills. Visit your doctor often for checkups, screenings, and discussions about your heart health. Treatment. Since anyone might experience a heart attack, it's important to seek immediate medical attention. Treatment options include aspirin. Chewing aspirin during a heart attack can help stop the development of blood clots. Thrombolytic drugs. In some cases, these drugs can break up blood clots and help the blood flow again. Painkillers. Substances like nitroglycerin can help relieve chest pain. Please always consult your doctor for any medications. Cardiac procedures. A balloon is used to unblock a blocked coronary artery in this procedure, and a stent is used to keep the opening open. Coronary artery bypass surgery states that in severe circumstances, surgery to bypass obstructed arteries and restore blood flow may be necessary. Cardiac rehabilitation. Programs for cardiac rehabilitation can help improve heart health through physical activity, knowledge, and lifestyle recommendations after a heart attack or cardiac operation. Lifestyle changes. It's crucial to continue with the heart-healthy routines advised for preventing heart disease after a heart attack. Ongoing medications. To regulate your heart's function and prevent complications, your doctor may prescribe you to take beta blockers, blood thinners, and tablets. It is crucial to recognize the symptoms and seek medical attention right away because acting quickly during a heart attack can significantly boost the likelihood of a healthy outcome. Please share this video with your loved ones and friends.